Hi Andrew, my name is Joan. I'm one of the nurse practitioner students. Today I'll be doing a musculoskeletal assessment on you. I did review your history and your allergies, and everything was unchanged. Do you have any questions or concerns that you'd like to discuss in today's visit?
No.
Okay. So just some questions here, same as before. I'm going to have you answer just yes or no to all of these questions that I'm going to ask, okay?
Okay.
All right. So have you had any recent weight changes, any fevers, fatigue, night sweats, anything like that?
No.
Okay. Any changes to your skin, rashes, lumps, sores, lesions?
No.
No. No itching, rashes?
No.
Okay. Any headaches, head injuries, lightheadedness, dizziness? Any vision changes at all?
No.
Okay. And you wear glasses? Okay. Any changes to any nasal discharge? Changes to your nose? Any nosebleeds at all? Any earaches, ear pain, ear drainage, and no nasal drainage? Sorry, I forgot to ask.
No.
Okay. Any throat pain, constant throat aches or anything like
No.
that?
No.
Okay. And no hoarseness, dry mouth, no sores in your mouth, nothing like that. Okay. Any swollen neck glands, lumps in your neck, any neck pain, neck aches?
No.
No like crick in your neck, nothing like that? Okay. Any cough, coughing anything up?
No.
No chest pain, heart palpitations, no high blood pressure?
No.
No shortness of breath?
No.
No waking up and having shortness of breath at
No.
night? Okay. Any issues with your appetite, any nausea, vomiting, diarrhea?
No.
Okay. Going to the bathroom regularly?
Yeah.
No changes in your urination?
No.
No pain on urination?
No.
No bleeding when you're urinating?
No.
Okay. Any sores or lumps, swelling, lesions on your genital area at all?
No.
Okay. Any muscle or joint pains?
No.
Any stiffness, neck aches, back aches? No neck pain, no back pain?
No.
Any arthritis or gout or
No.
history of? Okay. And no issues in your extremities, your arms and legs, no swelling, deformities, no breaks, tears, dislocations, nothing, no history of that?
No.
Okay.
Never.
Any changes in redness or swelling to your muscle aches, joints?
No.
Okay. Any limitations of movements or activity in the daytime or the nighttime? If
No.
one is worse than the other? No? Okay. And no history of trauma at all? No, again, you said no fractures, no
No.
dislocations or breaks?
Never.
Good. Okay. Any nervousness, changes in your mood, anxiety, depression?
No.
No suicidal or homicidal ideations?
No.
Okay. Any changes in your attention or speech? Any blackouts or memory issues?
No.
Okay. Any easy bruising or bleeding at all?
No.
Okay. And any issues with excessive sweating, excessive urination, or excessive thirst?
No.
Okay. So now we're going to move on to the physical examination portion, okay?
Okay.
Okay, Andrew, so for the first part of the physical examination, I'm going to start with your temporomandibular joint. What I'll do is I'll first inspect kind of this jaw area here to see if there's any swelling or any bulges, also checking for facial symmetry, and everything looks good. Okay, so the next part to palpate this joint, what I'll do is I'll actually put my fingertips in the front kind of in the front of your ear near the tragus. And I'll have you open your mouth really wide. Yeah, and it should, my fingertips, and you can close it. My fingertips should kind of fall into that little like divot or space as you open your mouth, and that, which it did, and that's good. And I didn't note any like redness or swelling, and no pain, no tenderness.
No.
Okay, Andrew, so the next part, I'm gonna actually do the range of motion of that joint. So what I'm gonna have you first do is, similar to what we did when we palpated, open your jaw as wide as you can, good, and then close it, perfect. And then I'm gonna have you actually jut your jaw forward, like the lower jaw, perfect, and then bring it towards you, yes, good. And then I'm gonna have you move it side to side if you could, right? And no pain or tenderness. No pain or discomfort. You're able to move it with no issues.
Yes.
Good. Next, we're going to move on to the wrists and hands. And what I'll do is I'll first inspect your wrists and your hands for any redness, any swelling, any gross deformities to your fingers and your wrists on both sides. And I don't see that here. Your color looks good. Next, I'm going to palpate both of your wrists. So I'll take your wrist here, and I'm just going to palpate here near where the wrist bone is, and just noting if there's any, again, swelling, any bogginess or tenderness, which I don't feel anything like that. No bulges, no pain when I'm palpating. No pain when I'm palpating.
No.
Okay. Okay, so next I'm going to palpate the carpal bones. So in both hands, I'm actually going to start off just palpating right here, distal to the wrist, and there should be little to no movement. And I'll start with like the distal, the middle, proximal phalanges. Okay. And on this side. Again, I'm noting if there's any swelling, any redness, deformities. I don't see. I'm going to palpate your carpal joints. So what I'll do here is I'll start with your right hand, and with my index finger and my thumb, I'm just going to squeeze here, and then just palpate the joints. And what I'll do is I'll also go down to your PIP and the DIP joints as well, and just palpate for any swelling, any I don't see any deformities, any tenderness, which I don't see. I'll do the same thing on this side. Good. To assess the range of motion of your wrist joint, so what I'm going to have you do is I'll have you kind of with your palms down. I'm going to have you flex your fingers toward the floor, yep, and then towards the ceiling, yep, and then I'll have you do it on the other side too, to the floor and then to the ceiling. Good. And then what I'm also going to do here, yep, and that's fine, I'm going to have you abduct and adduct your fingers, so, your wrist. So with moving your wrist, move yours towards your body, toward midline, yeah, and then away from your body. Good. So we'll also check the range of motion of your fingers and your thumb. So what I'm going to have you do is I'm going to have you take your hands and put it in a fist, and then open them. Good. And then I'll have you keep your fingers together, and then spread them apart. Great. And then with your thumb, I'm going to have you move it kind of in front of you like this, right? And then move it back. Good. The next thing we're going to do is I'm going to have you we'll test the strength of your wrist and your fingers. So I'm going to take my second and third fingers on both sides here, and I'm going to have you squeeze them as tight as you can. As tight as you can. Good, and they're even on both sides, pretty strong, great grip. Now Now I'm going to check for something called the Phelan test, and it assesses for carpal tunnel syndrome. So what I'm going to have you do is with the back of both of your hands, I want you to try to touch these two parts together just like this, keeping your elbows at full extension and your wrists as well. Just bend it together and just press it. If you do have any pain there, you know, that might be indicated for in carpal tunnel syndrome. Any pain?
No.
Good. Okay, Andrew, so for the next test, I'm going to do something called the Tinel test, also to test for carpal tunnel syndrome. And what I'll do is I'll press kind of along the median nerve on the carpal tunnel on both sides. And if you have any pain or tenderness, please let me know, okay? So I'll take this here, and then kind of right along this side here where the carpal tunnel would be. Any pain?
No.
Okay. And then I'll just, again, pressing. No pain?
Mm-mm.
Okay, good. And then the last thing that we're going to do is another special test called the Finkelstein test. And it tests for tenosynovitis. So what I'm going to have you do is I'm going to have you kind of tuck your thumb into your palm here and then fold your fingers over it. And then what I'm going to do, and I'll help you with this, is I'm going to add a little bit of pressure here to kind of extend the wrist. Do you have any pain, any numbness? No? Okay. Good, and then I'll do it on the other side, same kind of thing. And then I'll add a little bit of pressure here. And no pain, no tenderness?
No.
Good. Let's move up to the elbow, and what I'll first do is I'll inspect that area again just to see if there's any bulges, any redness, any swelling, which I don't see along the olecranon process. So that's good. And then on the other side, oh, I don't see anything there. And then what I'm going to do is, again, I'm going to palpate, which I kind of did already on both sides, but I'll also palpate the epicondyles here, so the lateral and medial, and let me know if there's any pain on the olecranon process and kind of where I'm touching here, where the epicondyles are.
Mm-hmm.
Is there any pain?
No.
No. And then on the other side, we move over. Same thing, no pain there, and there's no swelling or tenderness there, right?
Nothing.
Nothing?
Nothing.
Okay. The range of motion for your elbow. So I'm gonna actually have you bend your elbow right in front of you. Yep, and bend. Yep, and then extend the extension. Okay, and then just as you were before, I'm gonna have you hold your elbows out like you're carrying a bowl of soup. Yep, for that supination. And then turn them over. Yep, pronation. Perfect. Okay, Andrew, so now we're going to take a look at your shoulders here. And what I'll first do is, again, I'm just inspecting here. I'm looking at the asymmetry. You're kind of slouched a little bit, so, but right, as I can see that it is symmetrical on both sides. I don't see any bulges around the area. I don't see any deformities, any redness, swelling, which is good. I'm gonna palpate kind of near your clavicle here, near the sternoclavicular joint. I'm just gonna trace it up here, and then kind of where I meet at the end of the clavicle would be the acromioclavicular joint. Yeah, just kind of in this area here, kind of the top, and then I'll move my thumb over to the coracoid process, kind of right below it, and then towards the acromion process, kind of here near your shoulder here. Okay, and then I'm also going to palpate the bicipital tendon here. There's like a little groove in this area. Again, just noting any tenderness, swelling. And I don't. And I'll move to the other side and do that. Where your clavicle is. And then the acromioclavicular. Here, process. My thumb down. process is over here. And this groove here near the bicipital tendon. No pain or tenderness there, no swelling. And then from the posterior side of your shoulder, I'm gonna have you just sit up and turn around for me if you could. Yep. And I'll just trace laterally and upward the bony part of the scapula here, yep, until it becomes the acromion. Yes. And then on the other side as well. There we go. Till it becomes the acromion. We're gonna do some range of motion with your shoulder here. So what I'm gonna have you do is I'll have you put your arms out right in front of you at a 90-degree angle. I'm gonna have you lift your arms up, both of them, over your head. Perfect. And then I'm gonna have you put your arms behind you, so down and then behind you. Good. Yep, and then you can put them right back. Good, and then we're gonna do some abduction and adduction, and I'm gonna have you move your arms out to your sides. Yep, like hold it out to your side, and then over your head, lift it up over your head, and then down. Okay. And then for shoulder adduction, I'm gonna have you cross your one arm right in front of your body there. Yep, and then on the other side too. You can do it without me, so that's good. Perfect. And then we're gonna do the internal rotation. So I'm gonna have you kind of tuck your arm behind your, behind your back as if you're trying to touch your shoulder blade. I'm just gonna note the highest place where you can do that. Okay, good. And then on the other side, perfect. Okay, and then I'll have you turn around here. And I'm gonna have you lift your arm up to kind of the back of your head as if you were brushing your hair. Perfect. And the other side as well. Great, good. Okay, so now we're gonna do something called a drop arm test. So with one arm, I'm gonna have you put, raise it up 90 degrees at your side, and then try to slowly bring it back down to your side. And I'm looking to see if there's any sudden drop, that would be an injury to your shoulder rotator cuff. And the other side as well. And then you're gonna face me for this. This is called the empty can test. So I'm gonna have you hold out your arms, both of them towards me, and I'm gonna internally rotate it with the thumbs down, and then I'm gonna apply downward pressure and just try to resist it. Good, good. And that was again a test for a rotator cuff tear. The rotator cuff tendonitis, so what I'll do is something called the Hawkins sign. So I'll have you kind of flex your arm out like this, and I'm going to internally rotate it here, and keeping just my arm on your wrist and then underneath here. I'm gonna try not to resist, and then I'm gonna compress the greater tuberosity here, not having any pain or swelling or tenderness. Good. And then on the other side as well. So I'll kind of lift it up from 90 degrees, I'll lift it, and I'll compress here. No pain. Good. Test for rotator cuff tendonitis, something called the near impingement sign. So what I'm going to have you do is I'm going to put my hand up here in your scapula, and then I'm going to raise your arm up. Do you feel any pain there?
No.
And on the other side, same thing here, putting that pressure on the scapula. Any pain, tenderness there?
No.
So for this part, I'm going to do an assessment on your hips, what I'll actually have you do is just have you walk back and forth just a few steps so I can assess your gait. Good, and I'm checking, you can come right back, and I'm just checking, you know, the symmetry of your hips, your legs. You can sit back down if you want to. Noting if there's any shortening at all of the legs, you might indicate some kind of deformity or a hip issue there, so when I don't see any of that, and that's good. Okay, so now I'm going to palpate just some landmarks here. I'm gonna actually have you turn to your left side. Thank you. And then from here, I'm gonna just palpate the iliac crest, which is the highest part of the pelvic area here. Yep. And then I'll trace it down to the kind of like, so I'm sorry, to the butt bone area, kind of along where the sciatic nerve here is. Had to be gentle. You're having any pain in this area?
It's
okay.
just surprise.
And then the trochanter bursa would be here, in this area as well. No tenderness.
Mm-hmm.
No. Okay, so now we're going to do some hip flexion here. So I'm going to have you take your knee to your abdomen and lift up your abdomen as high as you can. Good. And then on the other side. Good. And perfect. Okay, then we're going to do a little extension here, and I'll help you here. So I'm going to move your leg away from the midline, kind of, yep, bend your knee. Perfect. And I'll do it on the other side, kind of going off of the chair here, okay? Good. Now we're going to do some abduction and adduction. So for the abduction, I'm going to lift your leg up here and here, just to support it. Move it away from your body, and then adduction towards the midline. Good. And then I'll do it on the other side. Away from your body, you're abducting, and then towards your midline, adducting. And no pain or tenderness there, right?
Mm-hmm.
Okay, good. And then for this last part, I'm going to do the internal rotation and external rotation. I'm going to have you bend your knee. Move it towards midline here, and then outwards. Good. And then on the other side, I'm going to bend your knee here, and move it towards, and then outwards. Good. Okay, Andrew, so now we're going to move down to the knees, and I'll start by inspecting your knees and just noting the contours of your knees, looking if there's any redness or swelling, which I don't see. The typical dimpling for both of the knees, there wouldn't be if it was swollen, and I'll palpate as well. And there's no redness or swelling, and no tenderness. Good. And then I'm also going to palpate the suprapatellar pouch of both knees. So I'll start here with your left knee, just right above. And then on the right side as well. Little pouch. Do some range of motion on your knees. And I'll have you straighten your leg, straighten your lower leg, and then bend it. Yep. And then on the other side, straighten it out, and then bend it. Good. So now I'm going to do a special test called the bulge sign, and it checks for minor effusion. So with your right leg here, I'm going to kind of milk this suprapatellar pouch here, and I'm going to apply some pressure as well. And then I'll do some tapping. If there was any swelling or fluid, you would see some fluid waves. And then on the other side here, just kind of milk it down, apply some medial pressure, and then again, there wouldn't be any because you don't have any swelling. So that's good. I'm going to do something called the balloon side to check for major effusion. So what I'll do is I'll keep my left hand here right above the suprapatellar recess, and then my other hand near the patella here, and I'm going to try to compress and see if there's any fluid or swelling that kind of shifts in between that space, and I don't see any. And I'll do it again on the other side here. And again, I don't see any like fluid or shift or swelling there, so that's good. Okay, Andrew, so now I'm going to do something that's called the Lockman test. It tests for an ACL tear. So I'm going to have you flex your knees like 15 degrees, kind of outwardly rotate, and I'm gonna grab the distal femur here and the tibia area, and I'm gonna apply some pressure. Right? You don't feel any pain or anything like that there?
No.
Okay. And then on the other side, I'll do the same thing. Okay, Andrew, so I'm going to do something to test for an ACL tear. It's called the anterior drawer sign. So I'm going to cup around your knees here, and I'm going to put so your feet don't move. And I'll try to kind of pull the tibia forward. And if it kind of pulls out like a drawer, that means that it's not intact. That's not what happens, so that's good.
Okay.
Okay, Andrew, so now I'm going to check for a PCL tear. Same kind of thing as the anterior drawer. It's a posterior drawer sign. So with the same movements, I have my knees on your feet so there's minimal movement. I'm going to cup around both knees here. And I'm going to have you, what I'm going to do is I'm going to press on the tibia posteriorly and check for the movement of the femur. There shouldn't be any little to no movement of the femur. If there was, that would be indicative of a tear. Okay, Andrew, so I'm going to do something called the adduction test, and what I'll do is I'll have my hands on your ankle and then your knee. I'm going to push medially at the knee and then laterally at the ankle, and if there's any widening at the joint, that would indicate an LCL tear. Same thing on this side. Good. Okay, Andrew, now I'm going to do the abduction test to test for MCL tear, and what I'll do is same kind of thing as before, have my hand around the ankle and then above the knee here. I'm going to apply some pressure, and if there's widening of that joint, that would indicate an MCL tear. Same thing on the other side here. Good. Okay, Andrew, so now I'm going to do something called the McMurray test that'll test for meniscus tear. So what I'll do is I'll grab your ankle here and around your knee. I'll kind of externally rotate it. If I hear any clicking or if there's any tenderness, that would be indicative of a tear. Would need more of an evaluation. And same thing on this side. Okay, right? Okay, Andrew, so now I'm going to move down to your ankles and your feet, and then what I'll do here is I'll first inspect it for any nodules, any swelling, any gross deformities, which I don't see, but I do see note some corn kind of on both sides of your big toe here. So what I'll do is I'll first kind of palpate the medial and the lateral malleolus for any swelling or tenderness. I'll kind of compress the MTP here. Yep. And then I'm just feeling like the grooves of the metatarsals here and the joints. Good. And then same thing on the other side. Palpate the lateral, the medial malleolus. Compress here. And then feeling the grooves. And then the joints of the metatarsal here. That's good. Do some range of motion with your foot. So I'm going to have you point your feet towards the ceiling and then try to point your feet towards the floor if you can, dorsiflexion. Good. And I'm going to have you turn the soles of your foot inward and towards your body if you could, and then outward. Great. Okay, Andrew, so now I'm going to move down to your spine. The last thing that we're going to do is I'm looking at the shape of your spine and looking posteriorly here for the symmetry, making sure that there's no deformities, no pain or tenderness when I'm palpating here. Good. And then looking from this side, kind of the side view here, just looking at your arch, not seeing any kind of over-exaggerated curves, no like lordosis or kyphosis here. So we're going to do some range of motion for the cervical spine, so your neck. So I'm going to have you bring your chin to your chest. Good. No pain or tenderness. Okay, and you can lift it back up, normal. Look up to the ceiling, perfect. Look over one shoulder, and then look over the other shoulder, perfect. And then I'm gonna have you have your ear touch your shoulder as best as you can, and no pain there. But any other side. Good. Motion to your spine here, so I'm gonna have you do some flexion. So I'll have you try to touch your toes as best as you can. I know it's a little hard. And try to keep your knees straight if you could. Good. Right, and then I'm gonna have you try to lean back as far as you can. I'm gonna support you back here. Okay. Rotations here. Okay, so I'm gonna support you by having my hand kind of around your hip and then on your shoulder. I'm gonna have you turn kind of towards your left side, and I'll help you here. Yep, and I'm just pulling and pushing at the same time. On the other side. Oh, sorry. Yep. And the other side. Good. And then the last thing we're going to do here is some lateral bending. So you're going to bend kind of on your side. I'm going to just assist you here a little bit. Good. And on the other side, as far as you can. Good. Perfect. Now, the last thing we're going to do is the straight leg test. So this is if you had something called sciatica, which is that lower back pain from the sciatic nerve, which you didn't indicate in the examination. However, the test for this would be with your leg kind of relaxed and straight. I'm just gonna lift here, and if you're having pain when I do this, that would be positive. All right, I'm gonna try to lift it up. On the other side, it can be on both sides. Which of course is negative here since you didn't have any pain. If you did have pain, it would be positive for the lumbocervical radiculopathy, but you didn't, so that's good. Okay, Andrew, and that would be everything for the physical examination of the musculoskeletal system. Everything did look good. Do you have any questions regarding this test?
No.
Okay. If you do have any other questions, please let me know. Thank you.